before we begin, I want you to imagine something. Imagine walking into your doctor's office for a routine checkup. You feel fine, maybe a little tired. Maybe you've been getting up more often at night. Nothing serious, or so you think. The doctor looks at your blood work. He pauses. Then he says something that changes your life. Your kidneys have already lost more than half of their function. You stare at him in disbelief. How is that possible? I never felt sick. And that's exactly what makes kidney disease so dangerous. It doesn't usually arrive with flashing lights. It whispers, long before it screams. Today, I'm going to show you 9 whispers your kidneys may have been sending for months, maybe even years. The final one is especially important because many people blame it on aging, when it could be your body asking for help. Let's begin. Here's something that shocked me when I first learned it. Your kidneys are only about the size of your fist. Yet every single day, they filter around 50 gallons of blood, removing waste, balancing fluids, regulating important minerals, supporting healthy blood pressure, and helping your body produce red blood cells. Think about that. While you're sleeping, working, watching TV, or spending time with your family, your kidneys never take a break. Not for 1 minute. Now here's the frightening part. Many people don't realize anything is wrong until kidney function has already declined significantly. Why? Because your body is incredibly good at adapting. One healthy part often works harder to compensate for another, which means your kidneys can be under tremendous stress while you continue living your normal life, completely unaware. But your body usually leaves clues. Small ones, easy to dismiss, easy to explain away. That's why I want you to do something while watching this video. Don't panic. Don't self-diagnose. Just ask yourself one simple question after each symptom. Has my body been trying to tell me this? You might be surprised by your answer. Let's look at the very first sign. Changes in urination. Let's start with the one clue your kidneys give almost every single day. Your urine. Now think back over the past few weeks. Have you noticed you're getting up 2, 3, even 4 times every night to use the bathroom? Maybe you've started going less often than you used to. Maybe the color looks darker. Maybe it's unusually pale. Maybe the stream feels weaker. Or maybe you suddenly feel an urgent need to go. Most people shrug it off. I'm just drinking more water. I'm getting older. It's probably nothing. And sometimes they're absolutely right. Changes in urination can happen for many reasons, including hydration, medications, urinary tract infections, diabetes, or prostate conditions. But here's what makes the kidneys different. One of their primary jobs is filtering waste and creating urine. So when that filtering system changes, your bathroom habits can sometimes change with it. Not dramatically, not overnight. Sometimes it's so gradual that you don't even notice until someone asks you about it. Think about that. How many people actually pay attention to what's normal for them? Very few. Your body often notices long before your mind does. So here's a question for you. If your urine suddenly looked different every day for the next month, would you ignore it? Or would you want to know why? Because the next warning sign doesn't show up in the bathroom. It shows up when you put on your shoes. And that's where many people miss the connection. Sign 2 swelling in your feet, ankles, or hands. Have you ever taken off your socks and noticed deep marks press into your skin? Maybe your shoes suddenly feel tighter than they used to. Maybe your wedding ring doesn't slide on as easily anymore. Most people blame the weather, or standing too long, or simply getting older. Sometimes that's true, but sometimes your kidneys are trying to tell a different story. Your kidneys help control the balance of salt and water inside your body. When they aren't filtering fluid efficiently, that extra fluid doesn't just disappear. It has to go somewhere. Gravity usually pulls it down. That's why swelling often starts in your feet, your ankles, or your lower legs. Some people notice their shoes don't fit by evening. Others notice swollen fingers first thing in the morning. Here's something interesting. Fluid retention usually isn't painful, which is exactly why people ignore it. They adapt. They buy bigger shoes. They loosen their watch. They stop wearing certain rings, without ever asking, why is this happening? Now remember, Swollen ankles don't automatically mean kidney disease. Heart conditions, certain medications, poor circulation, and many other health issues can also cause swelling. But here's the important question. Has this swelling become your new normal? If the answer is yes, your body deserves a closer look. Because the next warning sign isn't something you see. It's something you feel every single day. Yet millions of people blame it on getting older. Let's talk about fatigue. Have you ever slept for 8, maybe even 9 hours, only to wake up feeling like you never slept at all? You drag yourself out of bed. You make a cup of coffee. Maybe 2. For a little while, the caffeine helps, but by mid-morning, you're exhausted again. Most people blame stress, a busy schedule, getting older, or simply not sleeping well. But what if your body is working harder than you realize? Here's something fascinating. Your kidneys don't just remove waste from your blood. They also produce a hormone called erythropoietin. It's a hormone with a very important job. It tells your bone marrow to make red blood cells. Why does that matter? Because red blood cells carry oxygen. Think of them as thousands of tiny delivery trucks transporting oxygen to every muscle, every organ, and every cell in your body. Now imagine those trucks slowly disappearing. Less oxygen reaches your muscles. Less oxygen reaches your brain. And suddenly, everything feels harder. Walking upstairs leaves you unusually tired. Simple chores feel exhausting. Even concentrating on a conversation becomes more difficult. Many people assume this is just a normal part of aging. But constant fatigue that doesn't improve with rest isn't something you should simply accept. Now, fatigue alone doesn't mean you have kidney disease. Poor sleep, stress, thyroid disorders, anemia from other causes, depression, and many other medical conditions can all leave you feeling drained. That's why it's important to look at the bigger picture rather than one symptom by itself. So let me ask you something. Have you been treating your exhaustion with more coffee when your body might actually be asking a completely different question? Because the next sign doesn't make you feel tired. It shows up the moment you look into the toilet, and once you notice it, it's hard to forget. Let's talk about foamy urine. Have you ever glanced into the toilet and noticed your urine looked unusually foamy? Not just a few bubbles that disappear after a second, but thick foam that lingers. Most people flush and never think about it again. After all, soap residue, cleaning products, or even urinating with a strong stream can sometimes create bubbles. But what if the foam keeps coming back? Here's why doctors pay attention to it. Your kidneys contain millions of tiny filters called glomeruli. Imagine them as an incredibly fine coffee filter. Their job is simple. They allow waste and extra water to pass through while keeping important things like proteins safely inside your bloodstream. Now imagine that coffee filter develops tiny tears. Suddenly, things that should stay inside begin leaking out. One of those things is protein. When protein enters the urine, it can create persistent foam. It's a clue that your kidneys may not be filtering blood as effectively as they should. And here's what makes this so easy to overlook. There's no pain, no alarm bell, no flashing warning light, just foam. Something so ordinary, most people never give it a second thought. Now, persistent foamy urine doesn't automatically mean kidney disease. Dehydration, temporary illness, vigorous exercise, and other medical conditions can also cause protein to appear in the urine. But if you're seeing thick foam regularly, especially along with other symptoms we've talked about, it's worth mentioning to your healthcare provider. So here's a question. When was the last time you actually paid attention to what your body was trying to show you? Sometimes the smallest clues tell the biggest story. And the next warning sign is one many people mistake for a stomach problem when it could actually be your kidneys struggling behind the scenes. Let's talk about nausea and loss of appetite. Have you ever looked at your favorite meal, the one you normally can't wait to eat, and suddenly, nothing? No hunger, no excitement, just a strange feeling that tells you, I don't want it. Maybe you've even felt slightly nauseated for no obvious reason. You blame it on something you ate, a stomach bug, stress, or maybe you tell yourself, it'll pass by tomorrow. Sometimes it does. But when your kidneys aren't filtering waste effectively, those waste products can begin to build up in your bloodstream. Think of your kidneys as your home's garbage collection service. As long as the trash is picked up every week, everything feels clean and normal. But imagine if the garbage trucks suddenly stop coming. At first, you might only notice a small smell. Then the bags begin to pile up. Before long, the whole house feels different. Your body works in a similar way. Healthy kidneys constantly remove waste products. When that process becomes less efficient, the buildup can affect many parts of your body, including your digestive system. That's why some people experience ongoing nausea, a metallic taste in the mouth, or simply lose interest in food altogether. And here's something many people don't expect. Sometimes they begin losing weight, not because they're trying to, but because eating becomes a chore instead of a pleasure. Now remember, nausea and poor appetite can happen for countless reasons. A stomach infection, medications, acid reflux, gallbladder problems, or many other medical conditions can cause similar symptoms. That's why no single symptom tells the whole story. But if you've noticed a combination of these warning signs, especially over weeks rather than days, your body may be asking for attention. Let me ask you this. If your body suddenly stopped enjoying the food you've loved for years, would you see it as a coincidence or as a message worth listening to? Because the next sign is one people often blame on a pulled muscle, when it could actually be coming from much deeper inside the body. Let's talk about lower back or side pain. Pain in the lower back or side. Have you ever stood up from your chair and felt a dull ache in your lower back? Your first thought was probably, I must have slept wrong. Or maybe, I'm just getting older. After all, back pain is incredibly common. Most of the time, it comes from muscles, joints, or the spine. But here's something many people don't realize. Your kidneys don't sit where most people think they do. They're tucked just beneath your rib cage, one on each side of your spine. That means when a kidney becomes inflamed, infected, or blocked by something like a kidney stone, the discomfort isn't always where you'd expect. Some people describe it as a deep, constant ache that seems impossible to stretch away. Others notice it on just one side. And unlike muscle pain, changing positions often doesn't make much of a difference. That's because the source of the pain isn't in the muscles. It's coming from deeper inside the body. Think about the last time you had a sore muscle. It probably felt better after resting, stretching, or applying heat. Kidney-related pain often behaves differently. It lingers. Sometimes it radiates toward the side or groin. Sometimes it's accompanied by fever, changes in urination, or nausea. Now, it's important to remember, most lower back pain is not caused by kidney disease. Poor posture, arthritis, muscle strain, disc problems, and many other conditions are far more common. But if your pain is persistent, located higher than typical back pain, or comes with some of the warning signs we've already discussed, it's worth getting checked instead of simply hoping it goes away. Let me ask you something. How often do we treat pain with another painkiller without ever asking what's causing it? Sometimes the pain isn't the problem. It's the message, and the next warning sign doesn't hurt at all. In fact, most people never imagine their skin could reveal what's happening inside their kidneys. Let's look at that next. Itchy or dry skin. Have you ever found yourself scratching without even realizing it? Not because of mosquito bites, not because of an allergy, just itchy skin that never seems to go away. Maybe you've switched soaps, bought a more expensive moisturizer, drank more water, yet somehow your skin still feels dry, tight, or constantly irritated. Most people think, it's just the weather. I'm getting older. I probably need a better lotion. And sometimes that's exactly the reason. But here's something fascinating. Your skin is the largest organ in your body. And sometimes it's one of the first places where problems inside your body begin to show themselves. Healthy kidneys do much more than remove waste. They also help maintain the delicate balance of minerals and fluids your body needs. When kidney function declines, that balance can be disrupted. Waste products that would normally leave the body may begin to accumulate. Over time, this can contribute to persistent itching in some people. Imagine your body's filtration system as the air filter in your home. When it's clean, everything runs smoothly. But when it becomes clogged, dust slowly settles everywhere. At first, it's barely noticeable. Then one day, you realize you've been living with it for weeks. Your body can be surprisingly similar. Sometimes, itchy skin isn't just a skin problem. It's your body asking you to look deeper. Now, let's be clear. Most itchy skin is not caused by kidney disease. Dry hair, eczema, allergies, certain medications, and many other conditions are far more common. But when itching becomes persistent, especially alongside fatigue, swelling, or changes in urination, it's worth paying attention to the bigger picture. Let me ask you something. Have you been treating the symptom without ever wondering where the message is coming from? Because the next warning sign often strikes in the middle of the night. It can wake people from a deep sleep, and many never realize their kidneys could be involved. Let's talk about muscle cramps. Muscle cramps. Have you ever been in the deepest sleep, only to be jolted awake by a cramp so painful it felt like someone was twisting your muscle from the inside? You jump out of bed. You try stretching. You rub your calf. You walk around the room, waiting for the pain to finally let go. If you experience that, you know it's something you never forget. Most people blame dehydration. Or maybe they think, I didn't stretch enough today. And many times, they're absolutely right. But here's something many people don't know. Your kidneys act like your body's chemical control center. Every single day, they carefully regulate important minerals like sodium, potassium, calcium, and magnesium. Think of these minerals as electrical wiring that allows your muscles to contract and then relax. When everything is balanced, your muscles move smoothly without you even thinking about it. But when those mineral levels become disrupted, your muscles can begin sending the wrong signals. Imagine an orchestra. Every musician has to play at exactly the right moment. Now imagine one section starts playing too early, another too late, and another too loudly. The music becomes chaos. That's what can happen inside your muscles when your body's mineral balance is disturbed. Instead of relaxing, the muscle locks down, and that's the cramp you feel. Now, muscle cramps are incredibly common and usually have nothing to do with kidney disease. Exercise, dehydration, certain medications, nerve problems, and even sitting too long can all cause cramping. But if the cramps are becoming more frequent, especially when they're happening alongside swelling, fatigue, or changes in urination, it's worth asking whether your body is trying to tell you something bigger. Here's a question I want you to think about. What if the pain waking you up at night isn't the real problem? What if it's your body's alarm clock? Because the final warning sign isn't something you can see. It isn't something you can touch. It happens inside your mind. And it's the symptom that surprises almost everyone. Let's talk about brain fog and trouble concentrating. Brain fog or trouble concentrating. Have you ever walked into a room and completely forgotten why you were there? Or maybe you've been in the middle of a conversation, searching for a simple word you've said 1,000 times before, but suddenly it's gone. You laugh it off. I'm just getting older. My memory isn't what it used to be. And yes, aging can affect memory. Stress can. Poor sleep can. So can anxiety, medications, depression, thyroid disorders, and many other conditions. But here's something most people never connect. Your brain depends on a clean, balanced internal environment to function at its best. Every second of every day, your kidneys quietly help create that balance. They filter waste, maintain healthy levels of minerals, and support the production of red blood cells that carry oxygen throughout your body. When kidney function declines, the effects aren't always limited to the kidneys. Some people experience difficulty concentrating, mental fatigue, or what's commonly described as brain fog. It's not that you become less intelligent. It's that your brain may not be working under its ideal conditions. Think about driving through a dense fog. The road is still there. Your destination hasn't changed. But suddenly, everything takes more effort. You slow down. You hesitate. You second-guess yourself. That's exactly how many people describe brain fog. Simple decisions feel harder. Conversations require more focus. Names, appointments, and everyday tasks seem easier to forget. Now, brain fog by itself does not mean you have kidney disease. In fact, it's one of the most common symptoms shared by dozens of different medical conditions. That's why doctors don't diagnose kidney disease based on one symptom. They look at the whole picture. And that's the message I hope you take away from today's video. No single warning sign tells the whole story. But when several of these symptoms begin appearing together, especially if they're persistent, your body may be asking you to pay attention. The earlier kidney problems are identified, the more opportunities there may be to protect kidney function and improve long-term health. So, let me leave you with one final question. If your body had been quietly asking for help, would you recognize its voice? Because the goal isn't to make you afraid. The goal is to help you notice the whispers before they become screams. Before you leave, I want you to think about someone. Maybe it's your mom, your dad, your husband, your wife, a brother, a sister, or that friend who always says, "I'm fine." The truth is, most serious illnesses don't arrive overnight. They whisper. They leave tiny clues. Small changes, little warning signs that are easy to dismiss until one day they're impossible to ignore. If this video made you stop and think about your own health, there's a good chance someone you love needs to hear it too. So don't just scroll away. Share it, because the video you almost didn't send could become the warning someone else desperately needed. And if you believe understanding your body is one of the greatest investments you can make, join us by subscribing. Here on Dr. Wells, every single day, we uncover another message your body may be trying to send you. Tomorrow, we'll reveal another warning sign, another hidden symptom, another conversation your body has been trying to have with you. You don't want to miss it. Until then, take care of yourself. Take care of the people you love. And remember, your body is always talking. The wisest people never stop listening.